So still on this training module. So it's kind of like an efficiency tip that help do two things at the same time. That my senior taught me on my week one. Sometimes if you're on a time crunch, like within 30 minutes, you got a consult and then you need to see the patient and then after an hour you need to present, it might be like a little bit tricky. But if you got the consult at like 7 a.m. in the morning and you have like, they told you like 9:30 is the rounds, and this is a new patient that they gave you and you want to kind of like go through the case systematically, their template is a good template. This is basically, I'm dealing with this as a new consult. So most of your patients will be new consults. You will carry a couple of the old ones now, but eventually all your patients will be new consults until unless like you follow them afterwards. So this is logged into cardiology PVC here. So when you try to put in the note, you can either go to the consult tab or you can go to the notes tab. It doesn't matter. And if you go to consults and you hit the new note, just like Sujan was saying, it's automatically auto-populates the cardiology template. So the template is pretty good in cardiology. It's actually systematic. It's following the SOAP format. So the way I do like collect the information is the same way I plug in and go through the note template itself. So I have like a referring physician. I just go quickly to orders. I see who put in the order. So I go here, look up for the consults, and I see, oh, did they consult cardiology? Usually there's like, I think order review. And you look here since admission and you will see consult to cardiology. This patient, there is no cardiology consult placed as far as I can say. So if there's a cardiology consult, you will see who placed the consult and what's their question. And then I put that into my top part of the note. I will put like who is the referring physician, what is the reason for the consult. Chief complaint, I will probably go to start usually with the very first ED note. So you can see here this guy showed up on January 7th and then he showed up again on January 11th as well. So on the 7th, the very first note usually tell you why the patient is here. This one, let's see, cough 3 days, no fever, no sputum. And you can double check. On the 11th, he came probably for a different reason. Presented with a 30-minute history, intermittent heaviness, anterior chest. So the very first note in the ED, that's usually like the one that has the actual chief complaint that I go by. HPI is probably what I will be collecting after I talk to the patient. ED course, if the patient is fresh and is still in the ED. I mean, not all the consults will be from the ED, but like a big chunk of them will be from the ED. But like many consults are just patients in the hospital being there for like 3 days already. So if you're looking for ED course, you can follow up and see if the patient is just showed up to the hospital like a few hours ago. There's a good tab to see what happened. It's called event log. This one will show you like minute by minute all the things that were done. Like if someone came in with chest pain, you got consulted and the patient has been here for like, if anything more than 24 hours, I will probably go away from this because this is like too detailed. But if you want to figure out like he showed up here at 5:18, he got oxygen, they checked his vitals, took his weight, he got aspirin, they put an IV, they gave him nitro, they gave him, it's kind of sequential and the story will make sense. So that's something I usually go for the ED course if the patient's fresh. Review of systems, you can't fill it up yet because you need to talk to the patient. And then this is the cardiac history. So this is what they care about. And these are the questions that you actually need to ask the patient. Any new consult to cardiology, you need to ask these questions actively. You ask about diabetes, hypertension, hyperlipidemia, smoking, obesity, lack of exercise, age, and family history. And for family, there's something called the coronary artery disease equivalent, which is the PAD, carotid artery disease, abdominal aortic aneurysm, and end-stage renal disease. Don't forget about this. Many people forget, but it's actually a coronary artery disease equivalent. Then when I get to home cardiac meds, I'm kind of like put an extra effort here because that will help me presenting. So I go here to chart review, I go to meds, and then I just load everything. So ambulatory means outpatient, IP means inpatient. So anything ambulatory, these are the medications that the patient probably taking, and I need to confirm when I talk to him. But as far as I can see here, in this patient, I will write them down myself. So I'll just sit here and metoclopramide, NAS cardiac, aspirin. I just put aspirin 81. What else do we have here? Atorva 20, and then you can see Coreg. You need the Coreg with the dosage, of course. It's probably BID. And then Plavix, there's a Plavix for him. So all these things you need to mention to your attending. I will write them down as I'm chart checking, because eventually I will print this paper. And that's how I did it, but it's not necessarily how you want to do it as well. Lisinopril, you also need to put it with the dosages, and the nitro is here, so it's not an outpatient. So here basically they're just asking about they're just asking about the home cardiac meds. So I write them down with the dosages and the frequency, because that will be the tool that the cardiologist will adjust. If the patient have like high blood pressure, they need to go up on their blood pressure medication. So he need to know what is he currently taking so he can adjust it. So you need to tell them that. It's important. And then family history. So any family history of sudden cardiac death, this is a question that you will ask when you see the patient. Any history of premature CAD, this is a question that you will ask the patient. What is a premature CAD? They put it in the note, actually. They tell you like a father or first degree less than 50, or a mother or a first degree relative of less than 65. So everything is defined here. Home medications, they will probably auto-populate. And then physical exam after you see the patient, of course. Now you get to these are the objective information that the attending is basically expecting you to collect before you present. So the EKG, just like Sujan was saying, you go to the EKG and people say like, I don't know how to put the actual EKG in the note. And it's actually pretty silly. There is this tool here. I got to know this in residency. It's called snipping tool. I'm not sure if you guys are familiar with this. So if you don't have, I pinned this to my taskbar, but if you don't have it, any computer will have this one. So you just put snipping tool, and this one will basically you can anything you see on the screen, you can basically copy it and put it in the note. So I don't see any EKG that I can pull off here. Let's see anything here now. So I can't find the EKG, but for X-ray, for example. The nice thing, they are already telling you pertinent cardiac studies. So they want you to put in the EKG here. They want you to put the X-ray. They want you to put the echo, the stress test if available, and then the heart cath. If these are not available, just put not applicable. But you cannot just delete it. You need to tell like it's not there, not done, or not available, or done outside, records not there. But you need to comment on it. We do have the, I believe we saw the echo. So let's see, this is the echo, for example. At least you get the impression part, which is, I think it was at the top. So you basically take the conclusions. So this one is easy, you just basically copy and paste. Pretty simple. But let's say you got to something that you cannot actually copy, or you get like an image of an EKG. How do you get that into the note? You can use the snipping tool. The snipping tool basically I can snip anything. And then that part, I can just copy it and I just put it anywhere. So that's something to keep in mind. Snipping tool is very useful when you're collecting the data. And then you're gonna look just like Sujan was saying, the cardiac cath here. You just open it up, and then you go to impression. You need the impression part at least, and you just put it in. And then when you put it in here, you have all the information. You have the cath, you have the echo, you have the EKG done. If the X-ray have an impression, you put it in here. If you want to put the actual X-ray image, you can put it as well. And you have the cardiac meds. The other questions, it's already in the note. So now you say like, okay, so how is that helping me presenting? If you pen this note, if you go to your notes again, you will find your notes incomplete up there. So you just go right click, not sorry, not right click. You just go here, you can print it out, and I can just print it out, and then you can use that. If you already have the echo report, you do have the EKG, you do have the X-ray, you do have the meds already prepped into your note. So half of your note is done. You just need to talk to your patient, and that will be the subjective part and the review of systems and the exam. And then when you start with the attending, they will get you you need to kind of like think about your assessment and plan. But once you finalize it with your attending and fellow, you will have the rest of your note to be written. So at least this will get you half, like you will collect the information on the note, and half of the note will be done by that time. So that's how I did it. I have a couple of them every morning. I print them out before I present. For the progress one, like the ones that were just like following, like I already present them and the attending already know the patients. You probably don't need to be like that extensive in your presentation. You just like remind the attending, okay, this is the patient that was that we were consulted for heart failure. We were dialyzing yesterday. This morning he's doing better, less oxygen requirement, he like less leg edema, he's doing fine. So that's just like an efficiency tip that can help for the note writing part. The other thing I want you guys to see, so this is the video that I think Sujin was talking about, the Stanford 25. They do have like a very long list. I actually recommend like following their channel. They do have a lot of good exams, Stanford Medical, but this is the exam of the neck veins, Stanford Medicine 25. It's like 3 minutes, just show you how to examine properly the JPP, and that will help you with all this process. So that's all what we got for like initial stuff for cardiology, at least.